Concerns have been raised regarding blood clots following the first dose of COVID vaccination. This is a bit of a controversial question. It seems to be the case in lots of new drugs that we really only appreciate potential side effects after the drugs have been used for some time. In the case of COVID vaccination, of course, we've now rolled out nearly 300 million doses, although there's been several different vaccines with some different technology rolled out. In the case of AstraZeneca, and quite possibly some other vaccines, not yet in Australia, there's been an incidence of serious blood clots in very, very few cases. At the moment, we're not sure whether or not this represents an effect of the vaccine, or in fact, this is just part of what we see in everyday life, with up to 50 clots seen almost every day in Australia. With that in mind, however, the government has taken the approach of being particularly cautious given the sensitivity of vaccination and wanting to be sure that we minimise the risk. As everyone would be aware, the Australian context is very different. Overseas, we've just passed 3 million deaths secondary to COVID. In Australia, however, we've been extremely fortunate that the number of deaths have been very limited and particularly evident in older, vulnerable populations. With that in mind, the government has taken a very cautious approach, given that there could be an association. Mary?
So thanks, Michael. As we all know, COVID itself is associated with increased clots, and the risk of these serious clots is much higher with COVID than it is with the vaccine. Having said that though, we do have about 4 to 6 per million cases of people who've had the AstraZeneca vaccine getting these serious clots. But what we know is, as you've said, it's a risk versus benefit. So it depends on what the rates are of COVID in the community, which at the moment for Australia is very low, but we do have to be ready in case we get that third wave. We also know it depends on the individual risk. So it depends on the individual person as to what their risk, if they got COVID, was of having a very serious outcome, which might include not actually surviving it. And so then you need to make those decisions in conjunction with your doctor and to have that discussion to work out what is the right thing for you.
Fortunately, for me as a geriatrician, the risks in older people seems to be very, very, very small. And we are continuing to recommend in this very vulnerable population, and also those people who've got serious chronic disease, that they do get have vaccination, and that we do use currently AstraZeneca is perfectly safe in this population.
So unlike COVID in this vulnerable group, and the elderly in particular, which does have a very poor outcome, the vaccine itself does seem to be much safer. And so that's important when you're making your decisions.